I would see an adolescent patient for a wide variety of concerns. Oftentimes it's coming in and wondering, is it normal that I have not yet had my period? And it's very dependent on the level of distress that she may be experiencing. It can be very normal for girls when they first get their first period to have some irregular periods, but if it's at the point that they're really bothered by it and they don't know how to manage it, then I'm happy to see them, and especially if they're getting to the point where they're very self-conscious about some of the other effects that can go hand in hand with that. Once girls start going through puberty and getting their periods, if they notice that their periods are incredibly painful or very irregular, or if they have other issues with hair growth or severe acne, I would also work with them. I think with any patient, I realize it takes a lot of courage to come in to talk about your problems. So whether I'm seeing an adolescent or a couple who's struggling with infertility, I really do try to remember that. And so as soon as the teenager walks in, I generally immediately try to disarm her with some comment along the lines of, look, I'm sure you're going to survive your first gynecologist visit, and then you can tell all your friends about it. And so I think part of it is just being very candid and open, and addressing the fact that it might be awkward for her to be in my office, and making sure that along the way I do everything I can to make her as comfortable as she can be. I'm inspired every day by what I see, the bravery, the determination, anything from a teenager who comes in and sees me and she's feeling awkward and self-conscious, and 3 months later we've kind of gotten some things under control, and I see that she walks in with a different spring in her step and a different confidence. I think that that's incredibly gratifying. I'm Dr. Suleena Kansal Kalra, Assistant Professor of Obstetrics and Gynecology at Penn Medicine.